Alrighty, for today's live, we are talking about a popular topic right now, especially in the weight loss arena, and that's GLP-1s. So, if you have not heard about it, this is a medication type that individuals are using to try to help manage weight loss. Well, because of that, it's gained popularity, and people are talking about how much weight they're losing and how quickly. And in the clinic, one thing I've noticed individuals who are on these medications, they're also experiencing a loss in muscle mass in their strength. But it does not have to be that way. So we're going to talk about that a little bit more in just a moment. But first, let me take some time to at least define what GLP-1s are, how they interact with your body a little bit, and then some common name brands that you may have heard of. So just in case you don't know, GLP-1s are glucagon-like peptide receptors. So they interact with the type 1 receptors for glucagon-like peptides. When it comes to these medications, they help to suppress appetite. They also can help to manage insulin levels. Because of that, it directly impacts your blood sugar levels as well. So if you manage insulin, your blood sugar is going to respond. Because of that fact right there, these are very common and beneficial for several individuals who may be diagnosed with diabetes or even pre-diabetic. So it's not uncommon for individuals with that diagnosis to begin taking this medication. When it comes to appetite suppression, that simply means that now you're not as hungry. And it also can help give you the sense as if you're full for longer periods of time. So if you're looking to lose weight, this probably sounds like an amazing type of medication. But before you jump on the bandwagon, you need to talk with your medical provider first to make sure it is appropriate for you. Because just because it's a new current fad does not mean it's the best option for you. But even if it is a good option, you want to make sure that you're doing what you can to protect your muscle mass, as we'll talk about in a bit. So right now, we know that approximately 1/3 of the population within America, within the US, approximately 1/3 of population between the ages of 50 to 64 are taking GLP-1s. Now, if you notice that age range also includes individuals who are at increased risk of chronic diseases or chronic-based conditions such as diabetes, obesity, cardiovascular issues, blood pressure issues, those different things. So just knowing some of the information I've already told you as to how it can impact blood sugar levels and be beneficial for individuals who are diabetic, know that that is part of the reason why we're noticing a lot of individuals within that 50 to 64 age range while they're taking these medications. Now, in addition to that, you heard me mention some of the other chronic conditions, because as we get older, our risk for chronic conditions such as high blood pressure, risk of stroke due to cardiovascular issues, those risks can increase. These medications, we have shown that based upon the research that it can be impactful for decreasing inflammation in the body and even have cardiovascular health benefits as well. So it sounds like an amazing medication, but before you jump on the bandwagon, you need to talk with your provider because it's not appropriate for everyone. It is appropriate for some. And more specifically related to more of women's health-based conditions, we notice that in women who have endometriosis, PCOS, that they also may have benefits from taking GLP-1s to help manage the inflammation I mentioned before, and also some of the other chronic conditions that can go along with things such as PCOS, because we know that these women tend to be more insulin resistant. So keep that in mind when you're exploring and talking to your doctor about different options for you. But what are some of the common GLP-1 medications? Well, first we have Mounjaro, which is commonly used for things such as PCOS and also diabetes. We have Zepbound, and probably the one that has gotten the most recognition is Ozempic. So there's some other different types as well, but those are some of the ones that I most commonly see patients being prescribed. And because of that, those are the three that I've named. But there are different types, and those are more just the brand names. They're also generic forms as well. So when it comes to muscle mass loss related to GLP-1s, is it something that's really happening? The answer is yes, because part of the reason why GLP-1s work is that they allow for your body to decrease its mass. It allows for your body to lose weight. Well, it does not specify that you're going to lose weight from here and then maybe a little bit from over there. Instead, just like with weight loss, with everything else we know, it impacts the entire body. It impacts every system of your body. So you don't get to pick whether or not you're just going to lose fat or whether or not you're going to lose more lean mass. And lean mass is not always just muscle, but a good portion of it does include muscle. And because your body does not get to select what's going to be lost, muscle mass can be a major thing that people say that, hey, I've noticed I'm getting weaker. I've noticed that my muscles don't seem as defined as what they were. And the first question I always ask is, well, what are you doing to maintain the muscle mass? And more oftentimes than not, when individuals are taking these medications, from my clinical experience, from what I've seen, is that these individuals have not been told or prescribed the importance of doing resistance-based training. Instead, they tell you, oh, I'm walking. Now, I don't want you to stop walking. I want you to continue walking. I want you to continue doing your cardiovascular activity. But I also want for you to start resistance training. Do some strength training. And those who know me know I like to say I want you to lift heavy. And heavy is subjective, because depending on where you're starting with your resistance training, heavy can be something as simple as you standing up out of a chair without using your arms. So now you're doing sit to stands, which count as squats. Heavy also could be the exact opposite. Well, yes, you're loading up weights in the gym, but I want you to do some type of resistance training, because that can be very helpful in maintaining your muscle mass. Because if your body's just trying to lose weight, you can lose a little bit of everything, including the muscle. But if you're using those muscles, now your body's being triggered to say, oh, this is right here. These are helpful tissues. These are tissues that I need to continue to build and continue to form. So now you're stressing the tissues so that way they can get the benefit and continue to maintain their strength. And also you're not losing as much muscle mass. Now, with that, resistance training, generally speaking, 2 to 4 times a week is beneficial. If you've never done resistance training, don't feel like you have to start there. But I do want for you to start with 1 to 2 days a week. And I want you to start with activities that you feel comfortable with. So as I mentioned, you don't have to try to lift super heavy weights, but even doing sit to stands, you're learning how to do a plank. So you can't do a plank on the ground. Great, that's okay. Go ahead and do a plank at the wall or even a countertop, because now you're challenging your muscles. Walking is going to be beneficial. Biking, those activities are going to be beneficial, but those are more aerobic based, and those are going to be beneficial in the aspect of maintaining your endurance, helping with energy levels, and also cardiovascular health. But resistance training can have all of those benefits in addition to improving your bone density and also improving your muscle mass. So that's the one thing I want you to take note of, is that if you're using GLP-1s, you need to be doing resistance training, okay? This is so important. That's something I often see that people aren't doing when they're using these medications. So now something else you might want to consider, and I like to send my patients to a dietitian for this next one. And you may be wondering what I'm talking about. Well, in the very beginning, I told you that GLP-1s, that they actually can suppress or decrease your appetite. Well, that's great, because that means that you're not going to eat as frequently, especially if that's something that has been a challenge or struggle. But that also means that, before we said it's going to slow down digestion, so you're not eating as much. Now digestion is also slowing down. So your body's going to feel full much quicker. So you may have to rearrange and prioritize your plate a bit. I still want you to get plenty of fruits and vegetables and the whole grains, avoiding the processed foods. We know the processed foods can actually increase inflammation and have a negative impact on your body. But I also want for you to prioritize protein. And now protein, we can have the animal-based protein, plant-based protein, whatever works best for your body. There's no one size fits all. For me personally, once again, this is just for me, I notice that if I go too long without animal protein, I just start feeling weak. So this is where I tell my patients, I want you to work along with a dietitian, because a dietitian can help you better craft how your plate should look, better craft how many grams of protein your body may need to prevent muscle mass loss, prevent strength loss. So that way you can use protein, which is the basic building blocks of the muscles, to help continue to maintain your strength across your weight loss journey, or across the journey of managing whatever diagnosis or illness that you may be using GLP-1s to do. So protein, based upon your activity level as well, protein may be more important for some compared to others. And you already heard me say, I want you resistance training. So because of that, protein is already automatically important for you. But knowing how much you need to get, knowing the type that works best with your body, document what your symptoms are. If you're noticing, hey, after I eat this, I feel more bloated, or after I eat this, I feel more energized, because some people really do have those slight sensitivities here and there. But working with a dietitian can help you plan your plate and also better learn to interpret when your body is digesting well and absorbing your food, the nutrients from your food well, because digestion is important, but a part of digestion also includes the absorption of the nutrients. So resistance training and protein. Now that I've given you this information, I want to know, how's your protein intake, especially if you're on GLP-1s? And I also want to know, are you doing resistance training? If not, it's time that we have the conversation to get you more active, get you doing resistance training so that way you can start building more muscle, maintaining your muscle mass, which will help you long-term across the spectrum of life. And then also make sure that you're prioritizing your plate. So you may have to actually tell yourself, hey, I like carbs, but instead of me doing carbs, let me go ahead more so and focus on getting, a bit more protein in. But even with you getting a bit more protein in, don't forget you still want those fresh fruits and veggies. Yes, you can have them cooked. And guess what? Those count as carbs, but the type of carbs that you eat are important, especially if you're trying to make sure that you're getting enough protein in your diet, and especially if your body's becoming full quicker. So that's where a dietitian comes into play. Resistance training and your diet for the protein are so important when you're taking GLP-1, so that way we can manage you across the lifespan. Because for ladies who are listening, we know that around the age of 30, that we start actually losing our estrogen levels, which can impact our muscles and bones long term. So we want to make sure we're doing everything we possibly can as early as we can to maintain our bone density and also our muscle mass. So please make sure you're at your resistance training. Make sure that you are also eating properly, getting enough protein, especially if you're noticing that your appetite is more suppressed. And fellas, this is not just for the ladies, because fellas, guess what? Around the ages of 50 to 55, so early 50s to mid 50s, that is when a lot of men start noticing they're losing more muscle mass, and that's related actually to the decline in testosterone that occurs within the body. So men, make sure that you are also doing resistance training. And you heard me mention at the very beginning, on average, most individuals are in our mid-age range, the midlife range, when they are starting to take GLP-1. So we want to make sure that during that critical time where we know that people are already at risk for losing muscle mass simply because of aging, that when they're taking GLP-1s, that we're also doing everything we can to protect the muscle mass so that way you can continue to thrive. So am I telling you to take this or not take it? I'm telling you to talk to your doctor so that way they can help you develop a plan. But if you're taking it, I'm telling you to make sure that you do resistance training and that you also work with a dietitian to ensure that you're getting enough protein and all the other nutrients that you need. So if you have questions, please leave those in the comments. I'm more than happy to answer them. But also, if you find this information helpful, please like and subscribe so that way, one, I know, and two, I also can get more ideas as to different topics that you want to talk about. This particular topic came up because it's something I've been having to have a constant conversation, I feel like, in the clinic several times a week and sometimes several times a day. So I figured I'd share the information with you all as well. But let me know, give me your comments, give me your thoughts, and also like and subscribe.